It is so important, with glaucoma being the second leading cause of blindness worldwide, to really educate not only our patients, but also our community on the effects of glaucoma. Glaucoma is a silent disease, and so we want to make sure that we're educating our patients and community on the effects of optic nerve screening and pressure screening. It is also important, if you have a family history of glaucoma, that you start these exams sooner rather than later. The natural outflow pathway can become diseased over time. And so it's so important, when we're talking about early intervention, to be looking at that natural outflow pathway, to doing exams, looking at the angle, making sure there's nothing else going on in the angle that could be causing high pressure and therefore glaucoma, and making sure that we can treat early in the disease process so that there's not visual field progression over time. And that's why we're so passionate and so excited to be able to educate not only patients, but also our community on the importance of coming in, getting your eyes examined, your pressure checked, and your optic nerve screened for glaucoma. We know that patients that have been on multiple eye drops for years have the economic burden of paying for these drops. We see compliance issues as patients get older and more arthritic or have a harder time putting the drops in. And we're also seeing worsening ocular surface disease as patients have more and more of that burden of using drops. When we're talking to patients undergoing cataract surgery, it's very natural to talk about cataract surgery with minimally invasive glaucoma surgery. Patients get very excited when you tell them that there's an option to not only help them to see better with cataract surgery, but also to treat their pressure. And now we have great data and studies to back up why we're doing minimally invasive glaucoma surgery. We have even longer term data with iStent inject, showing that patients achieve their target IOP pressure, even minimizing the amount of drops as well. And so when the patient hears that we want to optimize their natural outflow pathway, stabilizing their glaucoma, and hopefully halting the visual field progression, as well as minimizing the drops that they have been using, they get so excited about it, because more than ever, they want other options besides drops. I brought the iStent inject into my practice because we had solid data. Glaukos as a company continues to evolve in the minimally invasive glaucoma surgery space. And so they've given me a lot of confidence as an eye surgeon to place these devices in a very minimally invasive manner.